Okay, so that's us live right now. Are you both okay if we just give it another couple of minutes for everyone to join and then we can go ahead and start?
Sure.
All right, that's fine. I'll just give it 2 more minutes. Right, okay, so thank you everyone for joining us again today for another one of our urology series webinars. So today we have a special session joined by 2 people from Aberdeen who've kindly joined us today, and they're going to be talking about the more practical aspects of the specialty of urology. So today, Gianluca is going to start talking about how to get into urology training, and then it's going to be followed by a discussion about what it's like to be a urologist and what sort of things you're likely to get down to doing as a urology consultant. So I'm going to go ahead and hand over to Gianluca now.
Great, thank you, Zach. So lovely to meet you all. My name is Gianluca Maresca. I'm one of the urology trainees in Aberdeen, currently an ST4. And as Zach mentioned, I'm going to talk to you about urology specialty training and how this is changing, and some hints and tips on how to do well in your interviews and score points on your applications. I wanted to start off by giving a brief introduction as to why I chose urology. And the list is never ending, I would say, but primarily I like operating. There are days where I like doing minor procedures, quick, effective, done and dusted. Everyone's happy, everyone goes home that same day. And there are other days where major surgery, which is what most surgeons have a very special calling for, take place. So nephrectomies, cystectomies, prostatectomies, these are all major procedures, which brings me nice to our second point. In urology, we have a vast array of technology and new equipment, and it's in a very expanding field of robotics, laser, new technologies such as those for benign prostatic hyperplasia, Rezum, Urolift. The list is never ending, really. And of course, traditional laparoscopy and cystoscopy alongside open surgery, which is the mainstay of what being a surgeon is all about. Another important point, and I think a very important factor for my choice of career, is the work-life balance, particularly if you're a very family-oriented person or you have other interests outside of surgery, such as academia, or if you have an interest in private work, then a career in urology, even from its early days as a core trainee or registrar, allows you that little extra time to do those activities on the side, which, to be fair, are also part of developing your career as a surgeon. So moving on to how to get into urology training. There are 2 pathways in Scotland and unfortunately only one in England this year. I'll start off by mentioning the Improving Surgical Training pilot, which is still ongoing in Scotland, and that is entry at ST1 level. From my current understanding, there is one post on the east of Scotland and one post on the west this year. And as I'm sure you all know, unfortunately, there are no IST posts in England. But nonetheless, there is still the ST3 entry route, which means you'd need to interview for core surgical training to start off with. And that's your first 2 years, which are, as I'm sure you all know, quite varied. You'll do a bit of urology, but you also need to do a bit of general surgery and potentially 1 or 2 other specialties, and then interview for your ST3 post. So very briefly, for those of you who are interested in the IST project and are keen on pursuing training in Scotland, there is an entry level at ST1, and the training continues all the way to the end of ST7. There are, of course, waypoints, there are checkpoints from a portfolio perspective, from an assessment perspective, which you will need to achieve in order to progress. But these are seldomly different to what you would see in other specialties, such as orthopedics or neurosurgery, who have been doing run-through for quite some time. As mentioned, there are no IST training posts in England, unfortunately. Hopefully this will change. And as already alluded to, there are 2 posts in Scotland this year. So let's talk about portfolio, which I think is what people worry about the most, and perhaps needlessly so, particularly because the guidelines on how to achieve a good score are always freely available, and that link at the bottom of that slide should lead you to what is expected or what the scoring system for your portfolios are as of this year. Here's a brief summary of the points and how these are divided. Obviously, some of you in foundation have done the MRCS. Most of you most likely would have done the Part A. A few of you will most likely have done the Part B. Of course, those of you in core training will have done that Part B in preparation for your ST3 interviews. So depending on which parts you've done, you get points allocated, maximum of 4. Surgical courses, these are non-specific courses such as basic surgical skills, core skills in urology, advanced trauma life support. They all count towards this section. And I believe each course scores up to 1 point. So 4 courses and your full points in that section as well. Surgical experience relates to taster weeks, which are usually done in the foundation, whereby you attend a department, in our case, urology. For a week, you shadow registrars and consultants on the day-to-day activities, attend theatre, and keep a logbook, as well as evidence of reflection, which also comes into the next section, surgical taster and reflection. So these 2 sections combined, a surgical logbook, surgical taster week, and reflection, carry 6 points, which are extremely easy to achieve, provided you are organized from the start. Similarly, for those of you who are still in medical school, a surgical elective, ideally in a foreign country, although this year they will be a bit more lenient given the COVID situation, which reflection of activities undertaken during that elective can score you a maximum of 3 points. Presentations and publications go hand in hand, and I'll come back to this shortly, but speaking to registrars, to consultants within the relevant departments can easily get you involved with a project which, as a minimum, 9 times out of 10 will lead to a presentation at a national or international conference. Publications are a bit of a more long-term commitment, but certainly over the last year, I had a foundation doctor and a CDF. Together we came up with 2 publications, and we are working on a third one, which is going to be quite a big one. So it's not impossible to do before your interviews. On the right-hand side, postgraduate degree. If you have this, you have this. If you don't, it's not a big deal. Most candidates will not have a postgraduate degree. So I wouldn't really stress too much about this. But by postgraduate degrees, we mean MSCs and PhDs. Prizes, anytime from medical school through to foundation and core training, all prizes count. In order to get prizes, you have to do extra work and you need to present your extra work, usually at conferences or within a medical school or foundation training setting. Quality improvement and audit and the presentation of this, as you can see, carries a significant amount of marks. And these go hand in hand with presentations and publications, because let's face it, if you come up with a really good quality improvement project or an audit, which can be reproduced across other departments or within other hospitals, then that is something which will be easily accepted for a presentation, scoring you points for that section. Presented potentially at a national or international conference, which will score you points in the presentation section. And also, I did this in my foundation, published my quality improvement project in the BMJ, which again scored an exquisite amount of points in the publication section. So it's all about, what I'm trying to say is it's all about being smart and choosing projects that will give you marks in more than one section as highlighted. Teaching experience, I mean, Zach is scoring millions of points in this. You know, he's organized a good course. He's brought in speakers from various specialties to cover various topics. So showing that you are engaging in that kind of teaching, that you have feedback from those you are delivering teaching to, and also making a habit of teaching and obtaining feedback will score you a good chunk of points in your portfolio as well. From a personal perspective, I organized a very simple regional teaching course, essentially once a week for, I think it was 12 weeks. So we had 12 sessions, one from each specialty, surgical, and also included our anesthetic colleagues and some of our medical colleagues who deal with perioperative optimization. For example, the geriatricians on the orthopedic wards, or the renal physicians on the urology wards who help with optimizing patients pre and post-operatively. And I displayed this in my portfolio. I asked my educational supervisor to just write a short letter explaining what I had done and of making it official, essentially. And that scored me quite a lot of points in that section as well. The next one is training and teaching. The way to score points in this is to go to training the trainers course. It costs £600. It's usually done in London, although Edinburgh, I believe, run the course once in a while as well. This is not an ad, by the way, but unfortunately, from a real life perspective, unless you have a postgraduate degree, such as a PG cert in medical education, in order to score points in that section, you need to sit that course or show that you've attended a similar course, which is validated by a recognized institution. Finally, the last section is leadership and management. And this is a very broad and very generic section, which is very often rated based on personal reflection or references obtained during activities done in the hospital. For example, in my case, having organized and led that teaching course for those 12 weeks also counted towards showing leadership and showing people management and time management in balancing my work as well as my extracurricular activities, such as that training course. But leadership can be assessed in other ways as well, from your make full use of your portfolios, both in medical school, in foundation, and also in core training. So if you have, let's say, good tabs or good feedback or good multi-source feedback forms from trainers or peers, make sure you print those out and add them to your portfolio, because the examiners and the people on the panels are there to give you marks. I think that's one very important thing that everyone should keep in mind. Use what you have to your advantage. Print it out, put it in a nice bound folder. My one still lives on my bookshelf, hidden away, preserved, I should say, for future use, and keep it up to date as you go. One thing people tend to do, and unfortunately leads to a lot of stress and panic, is leave everything last minute and print everything out, and suddenly your printer's not working or you can't find that certificate. You email people, but it takes ages to get these things through. So just start slowly. Everything you do, document, reflect on, if possible, get someone to validate and put into a folder. So by the time of your interviews, you obviously have everything there to score your points. And needless to say, you guys here today are interested in urology. So remember to make your portfolio urology themed, particularly if you are applying for the IST, for the run-through training. It's not as important for core surgical training, but you definitely have to show commitment to surgery and the willingness to go the extra mile to be the surgeon you want to be. Surgery is a very interesting specialty in the sense that it's an apprenticeship. You learn a lot on the job. You learn a lot by staying late. You learn a lot by using your free time to go the extra mile. If you're in theatre and it's something that you've never done, try get involved. If you're in theatre and it's something you've seen or you've done a million times, and perhaps there are time pressures, then use that time to either get scrubbed in, or if you can't scrub in, then while in theatre, not to miss out, of course, do something extra on the side. Read a paper, do some data collection, just get your projects going. Make good use of the 8 hours you're at work for, or 12 hours, wherever it is. Or if you're in med school, if you have a free period between 9 and 10, yes, you can go to the canteen, but the library is there, or the wards, see a patient, have a chat. And this is how you get your points. It's hard work, and it doesn't really get easier. But of course, as you progress, you start enjoying things more, I would say, because it's driven into you. It's something you want to do because you want to improve as a surgeon and as a person. And it's not easy getting into training, and I don't want to put you off by this, but this is the reality. For core surgical training, the competition ratios were let's say 4.5, but it's 5 candidates to 1 place. Whereas for urology ST3 this year, it was 3 candidates to 1 place, which doesn't sound like a lot, but when you put in perspective, if there are 50 places, you're competing against 150 other guys and girls who want to get into the specialty. It's even worse for run-through training. There were 2 places in 2019, which was when I applied. There were no places the following year. There was 1 place in 2021. Sorry for the typo. And I believe 2 places this year again. So it is difficult, and you really do have to up your game and get your points. So a few tips. I won't bore you too much, but download the self-assessment guidance early. Make sure you're familiar with it. Start ticking those boxes. For those of you who are still in med school, now's the time. Don't waste any time. It's never too early. For those of you in foundation, make the most of your hospital time. As I said, if you're on a surgical block and you want to come up to urology and have a chat, see a quick procedure. As we mentioned, we do a lot of minor quick procedures. Just come to theatre. We're most urologists, I would say 99% of urologists are happy to teach and happy to have you there, because as a specialty, we're very chill and we're very happy to teach. Do a taste a week, come join us for a week, why not, and attend your courses. And if there is something which you are unsure about or something you want to learn specifically, just ask. If someone came up to me and said, I really don't understand what the treatment for prostate cancer is, can we go through it? We'll go to theatre, we'll look at the robot, we'll have a chat, we'll take it from there. And you could also do this on your study leave. Of course, it's kind of frowned upon, but if you have a reason to be on study leave, and let's say you're on a course which lasts till midday, you still have the whole half of the rest of the day to go. So why not pop in and go to theatre, have a look, go to clinic. And importantly, use your educational budget. For those of you in foundation, it's a good chunk of money which you can spend on courses. Some of the courses you have to do are mandatory. So I appreciate that, but have a look around. You can sometimes work the system a little bit and get a little bit more funding for relevant courses after discussion with the TPD. I did my core urology skills and foundation, and I got that paid for alongside my ALS, ATLS, and all the other courses you guys are forced to do, unfortunately. It's just the way it is. So as I mentioned earlier, speak to trainees. I've given this talk with Mr. Athanasiadis not too long ago, maybe a month ago or two, and I had a couple of medical students reach out asking for audit opportunities, and I actually have one starting with me this week on a project, which is a very big project, and I have another one lined up for another medical student who's keen and lined up for a project which I'll be starting early next year. So go up to someone, introduce yourself, and most people will have projects. I mean, I come up with projects sometimes after reading something or in theatre after I see something. There's always a question in my head, and I think, let me have a look at the literature. Can we do better? And that's how most of my projects tend to start. Easy points, sit your MRCS, just get it done. If you guys are still in med school, once you qualify, get your MRCS, Part A out of the way, everything's still fresh in your memory from your finals. If you're thinking about Part B, there are websites you can use. There are trainees or even foundation doctors you guys can practice with. It's all about communication. It's all about confidence. It's all about how you answer the questions. There is a knowledge element to it, of course, but by the time you've decided you want to be a surgeon, you would have that knowledge, of course. And I hope, my very short presentation aimed to highlight that it's not easy. You don't just wake up one day and you're a surgeon. There's a lot of hard work that goes into it. And people do well when they're driven and when they don't lose sight of what they want to be. From my early days in med school, I think from my third year, I didn't know I wanted to do urology, but I knew I wanted to become a surgeon. And I always saw ST3 as an important milestone. So from the early days, from third year in med school, I always thought, what could I do to get ahead, to get my points, to be prepared for ST3. And when ST3 finally arrived, looking back, I've done a lot of things which have helped me, be hopefully average ST3, as Mr. Athanasiadis can vouch for, I'm sure. Once you reach training, once you're a registrar, it doesn't feel like work anymore. It's more of a lifestyle. And it's important to have a supportive family, a supportive partner, supportive friends, and a supportive department, because, I come home sometimes from work and I know at the back of my mind there's that project I want to finish or that paper I want to read or my whiteboard needs updated with the latest facts I've learned that day. And it's just the way it is. It's a lifestyle. So that's one thing that you guys need to be aware of before you start surgery. Here are a few resources for you guys in case you're interested. Some websites for the MRCS examination, those of you who are sitting in Part A or Part B in the next few months. Of course, the Royal College, I'm a member of the Edinburgh College, fancy Edinburgh website, has great courses on offer, as well as BAUS, the British Association of Urological Surgeons. And for those of you who work in England, there's the the English College website there as well. I'm happy to take any questions, Zach. Of course, if anyone's in Aberdeen or in the east of Scotland and wants to collaborate on projects, feel free to drop me an email.
Thank you very much, Gianluca. That was a great presentation. I'm happy that you put your email down. So if anyone feels like they'd like to ask a couple of questions later on, maybe after the session, then feel free to send Gianluca an email. I'm sure he'll be more than happy to respond. But I think in the meantime, we'll carry on with our presentation just now. And if anyone has any questions, you can pop them in the chat box at the end of the session. So the next part of our presentation today is going to be a chat from Mr. Athanasiadis, who's going to be talking about life as a consultant urologist. So I'll hand over to you.
Hello.
What I'll do is I'll stop sharing my screen, Mr. Athanasiadis, and you can take over.
I will just start sharing my screen in a second. Hi, I'm Mr. Athanasiadis. I'm one of the urology consultants in Aberdeen. So what I'm going to talk about is the life as a urology consultant. Sorry. So as you know, the urology is the surgical specialty that is dealing with the urinary tract, the male and female, and the male reproductive organs. So the big question is, what do I do? How do I spend my day? It is a surgical specialty, so there is a strong technical skills element. However, it's 10% skills and 90% work. I think Gianluca mentioned a few times already that it does require quite a lot of work. I could not agree more. There is also an element of non-technical skills. So just because we do work in a very complex environment, we are leading a large team in theaters, we work quite often under pressure. So communication and team working is paramount.
Okay, it looks like Mr. Athanasiadis must have disconnected.
I'm sure he'll be back in no time.
Yeah, that'll be fine. We'll just give him a couple of minutes. Sorry, guys.
Hello, can you hear me?
Ah, yes, we can hear you.
I'm terribly sorry. There's power outage here, unfortunately, for some reason.
No, that's fine.
My cell phone is still working.
Are you able to put this? Oh yeah, you are. Okay, that's fine.
I'll share this. I'll share the slides for you, Grigoris, if you want to carry on.
Thank you so much. Thanks, Gianluca. So I'm sorry about that, everyone. We're kind of in the dark here, but I think I can cope from my phone. So I was just mentioning that we often work under pressure, so sometimes we do need to improvise. So I was just saying that there is a strong element of, so communication and team working basically is paramount. We do interact a lot as a specialty by default by other surgical specialties. So we work quite often with the general surgery team. Sometimes we do work with the gynecology team or other specialties. So that is actually one of the key elements for improving you as a surgeon and give even more interest to the work. The most important question, though, if you are to, to choose your, urology as your profession, is whether you can see yourself as a surgeon. Obviously, that does apply for all surgical specialties. So in urology, there's also a strong element of clinical medicine. So it's one of the few specialties that blends clinical and surgical, the clinical aspect and the surgical aspect of our work. There are not too many. I mean, the one that easy comes to mind is ENT, that does do quite a lot. So the other thing that is quite important is and quite interesting is that there is a lot of imaging involved. So a radiologist is a urologist's best friend, as I like to say often. So we work very closely with radiology for diagnostics, but also for intervention with the intervention radiologists. There is a lot of physiology and pathophysiology background, just because there are many different organs involved. And quite often in urology, we have the privilege, if I may say so, of the differential diagnosis being relatively straightforward most of the time. So quite often in urology, 1 + 1 does make 2. Mostly, we do know what's going on within minutes. So I would think that if you are very much into differential diagnosis, probably urology is not for you. Also, what I find quite interesting for urology is that quite often we're treating cancer with curative intent. So there are quite a few, quite a few examples with regards to that. So testicular cancer, yes, there may be surgical treatment, chemotherapy, radiotherapy involved, very major surgery. But at the end of the day, we cure almost everyone. Prostate cancer, if we pick it up early, we do apply our surgical or radiotherapy treatment with curative intent. Same with small renal masses. Same with quite a few different conditions. Quite a few cancers. Also, we quite often are dealing with quality of life issues. So one might say that at the end of the day, we do have quite a few happy customers. But the biggest advantage to me, though, of urology is that there's a huge range of things one can do within the specialty. So the workload varies from, from office urology, very clinic-based urology. When we do examine patients, we do our differential diagnosis, offer treatment, sometimes do minor procedures, to very major open or minimal invasive surgery, or very, very major laparoscopic, robotic, or open surgery, and quite a lot in between of major or minor surgery. I think that is very important and links in very well with what Gianluca mentioned earlier about the work-life balance within the specialty. Because I do get the feeling that in medicine, we do get rushed into taking decision after decision after decision into what will happen next. So I, for example, had to take the decision of becoming a doctor at the age of 15 or 16 years old. And then finishing medical school. Soon enough, I needed to pick up the specialty I would follow to apply for it. And then the big advantage of urology that I realized is that I had still time to decide what I will sort of become in life, just because of the huge range of things one can do within the specialty. So that, I think, is a very big advantage. So how does my day look like? So it varies a lot. So I have clinic commitments. So I do see patients in our outpatients department, mostly patients with general urology conditions. I have a subspecialty interest. My subspecialty interest is robotics, basically mostly in small renal masses, but in renal cancer in general. So I see my cancer patients in our urological cancer center. Is a charity-based center we are blessed to have in urology in Aberdeen. Also, I have theaters commitments. So my main theater list is in our Miss B theater, the minimally invasive surgery theater B, where our robot lives. And also I do my general urology operations in our Ward 202 theater. Also, we do run on a weekly basis a multidisciplinary team meeting where our oncology colleagues, radiology colleagues, pathology colleagues, and obviously ourselves, everyone who has an interest in urological cancer attends, and we discuss all patients with a new diagnosis of urological cancer or some other patients that we need to move forward with a treatment, which is an excellent opportunity for us to make sure that we are providing our patients with optimal care. There is a lot of admin. That is what I describe sometimes the undying monster, the Hydra, if you are familiar with ancient Greek mythology. So, but one needs to understand that admin is at the very core of what we do. It's essentially reviewing patients' cases, reviewing their scans, reviewing the blood results, reviewing pretty much everything, and come up with a plan for them. And then apply the plan. So let the patient know, let the GP know, request the scans, and essentially progress with their care. There's also a lot of teaching that is happening, a lot of teaching on the ward. We have obviously our senior trainees like Gianluca. We have our junior trainees, our FY2s. We have medical students, PA students, student nurses. We have nurses. We have specialist nurses. So there is a lot of opportunities for people to teach if you like that. And also there are on-call commitments. So the way it works in urology is that it's 8 of us participating in the on-call rota. So we are on call for 1 week in 8. As Gianluca already mentioned, there's a lot of academic opportunities. Again, in Aberdeen, we are blessed to have a very strong academic department led by Professor Endau. So the academic unit has got very strong links with the European Association of Urology, and in particular with the guidelines office of the European Association of Urology, which is one of the best functioning organizations producing guidelines for urologists across the globe. Naturally, just because of the variability of the conditions within the urology, and just because urology does take under its shield quite a lot of different organs,
there is a huge range of academic opportunities. So as Gianluca already mentioned, if you are interested, I mean, and you would be, even with us, you're more than welcome to approach us, and we can support you with this. And obviously, do get in touch with your local urology team, especially in bigger academic units. There are always ideas that are, that people have. There's a lot of technology in urology. I did mention imaging already, but there's a lot of robotics. So we do most of our major operations nowadays with minimally invasive, and in particular in robotics in Aberdeen, and quite a lot of places, quite a lot of centers across the globe. Also, there's a lot of laparoscopy. There's a lot of endoscopy. So we treat endoscopically stones, various different tumors. We do, as I mentioned earlier, quality of life improvement operations like TURPs, removing people's prostates. There's laser technology that we're using. Urology in general has been at the forefront of use of technology for decades. And again, if you like working with technology, I think there's no better place than urology. And I think what again links perfectly with the quality with a balance of work and life is private work. If you are interested in doing private work, again, there would be time in urology should you choose to do that. I mean, I think both Gianluca and I discussed about this because we think that this is quite important. I mean, some people, we don't really see it when we're in our 20s, but we start thinking about it quite a lot when we are in our 30s or older. The life-work balance is quite important, and it's quite important that there is a surgical specialty that can provide us with that. Mostly, we work office hours. That is a big difference from most of the other specialties. The on-call pattern, it's a rare occasion when our presence as consultants we would be required to be on site, and it's even more rare that we would be called to be present ASAP. So that is quite important, and also helps with a lot of flexibility with how you set up your on-call timetable. Makes it very easy to have swaps with your colleagues, and in general makes your life so much easier. Days in theaters, especially if you choose to do major surgery, can be quite long. So if you choose, for example, to be doing cystectomies, which are quite long, quite complex operations, it's likely that you will spend in a lot of time in your, most of your day in theaters whenever you have a case as such to do. But you can pick and choose, as I mentioned earlier. You can pick and choose in urology how your life is going to be. I could not resist by putting this. I have a love for robot. Gianluca, I know, shares that with me, so I could not resist to put that. I'm happy to take any questions, Zach.
Excellent. Thank you very much for the presentation. That was brilliant. And I hope it was as useful to you all as it was to me as someone who was hoping to go into urology at some point. Would anyone like to put a question in the chat box before we end our session? I'll just give a minute for anyone who'd like to type something in. So there's a question who I'm not sure which one of you guys will be comfortable answering this, but are there many trainees in urology who train less than full time?
I think Gianluca probably would be in a better position to answer that.
Yeah, I can only speak for the east of Scotland because that's the region I'm training in. But from my current knowledge, there are, let me just count very quickly. There are about 10 trainees in total, maybe more, maybe about 12. And there's a girl who obviously went away from maternity leave recently and came back less than full time. So it's doable. It is doable. And the deanery, at least the East of Scotland deanery, the Scottish deanery, particularly East of Scotland, because that's all I can really speak about, is usually very accommodating. There have been other people I know who have trained in England as well, who have taken time out for various other things, or who have done less than full-time training to keep up with other commitments, such as family or even academic commitments. So it is doable. One important question to ask yourself before going for less than full-time training in any specialty really is what are your long-term career goals? If you want to be doing high-end difficult surgery, that requires quite a lot of intense and quite a lot of prolonged training. So doing something like that less than full time requires an even bigger commitment because it will take you slightly longer. But short answer is less than full time training is doable in urology. Yes.
Perfect. Okay, thank you very much. Can I just ask, would you be able to pop the slides back on just to the very last slide, if that's okay? Thank you. That's perfect. Right. So thank you very much, everyone, for joining us again. And thank you, both of you, for the great presentation. So what I'll do is we have a link here for an email address that you guys can use. If you have any other questions you'd like to ask, just send us an email and I'll be sure to relay them to either Gianluca or Mr. Athanasiadis. And I'm sure they'll be happy to respond. Otherwise, I've put in a QR code here that you can use for feedback, and you'll get a certificate from that. So do go ahead and do that. I've also put the feedback link in the chat box in case you want to use that. And be sure to join us next time on AKI and hyperkalemia. So thank you very much, everyone.
Thank you so much for organizing this, Zakarian, and thank you everyone for joining.
No problem at all. Thank you. Thank you again.